Hello, everyone. It's Dr. Stephen Lin here, and I'm doing a live Q&A with Dr. James DiNicolantonio. He's joining me from the United States of America, where we are, and we're going to dive into his work. He's a cardiovascular researcher. He's authored multiple scientific research papers and authored and co-authored 3 books. And we're going to dive into his approach into preventing cardiovascular health, but also some really interesting work that he's done on mineral balances in the body, how that connects to heart health. And obviously, this is a big interest to me because I focus on teeth and bones, but James is one of the world's foremost experts on mineral balances. So I'm really been looking forward to this conversation. James, thank you for joining me today. How are you, man?
Thanks. I'm doing good, Stephen.
James, you're a really busy guy. Let's just dive straight into it. But I'm kind of interested into your story. You're a cardiovascular researcher, but how did you start stepping into this world of nutrition-based preventative health, and how we prevent heart disease? But really, there's so much more information you're putting out these days. Where did it all start?
Yeah, that's a good question. It sort of always starts with like an anecdote, right? Or like your own personal experience. Like in high school, I wrestled and ran cross country, and I always knew about the importance of nutrition and particularly salt for performance, for athletic performance. And when I was practicing as a pharmacist, a community pharmacist, like out seeing patients, I was having a lot of them come to me with symptoms of salt deficiency. So basically like dizziness, fatigue, their exercise performance wasn't doing well. And I would sort of push back and say, well, what has recently changed? They were put on like a blood pressure medication, like a diuretic, or their doctor told them to cut their salt intake. And a lot of times when they would go back to their doctors, because I would say, well, why don't you either get like a BUN, a blood urea nitrogen, to see if you're sort of volume depleted as long as your kidney function's good, or your sodium levels. And a lot of times they would come back low. And instantly when the doctor would either cut the dose of the blood pressure medication or tell them to up their salt intake a little bit more, they instantly felt better. So it was like what I was seeing in the real world wasn't really translating to these low salt guidelines. And really that's what led me to start researching for the Sulfix. And that was like the jump off point for me to actually start researching nutrition. And then I really got into it when I actually was lifting weights. I used to lift very heavy, and I actually tore my pectoralis tendon. And I couldn't just this was when I was 26 years old. And I couldn't just eat whatever I wanted anymore. I couldn't lift heavy and get away with eating junk food. So I really had to I almost selfishly dove into the literature to figure out how I could improve my diet, because I couldn't exercise my way out of my bad diet anymore.
Yeah, right. So, and what were you finding? I mean, you were a practicing pharmacist, and what did you find in terms of obviously the recommendations are generally for people to cut salt, and obviously this is more what you were doing, when you were performing. But what was the scientific basis behind that? What were some of the recommendations that people were obviously getting from the doctors, and what was some of the the rationale behind the connections to cardiovascular health that you were seeing, and how is that making not so much sense in your mind?
So basically, I mean, most doctors are trained. It's ingrained in them that salt is bad. They're not taught that this is an essential mineral. They're just simply taught salt equals higher blood pressure. And if you see a patient with high blood pressure, the first thing you're supposed to do is tell them to lower their salt intake, because it will, in most cases, lower blood pressure a little bit. But I could tell you to only drink a single cup of water per day, and that's just going to volume deplete you. So the problem is we just hyper-focused on surrogate markers. The same thing could be said with saturated fat, why that was demonized. Because if you swap out seed oils, omega-6 seed oils, and you replace it with saturated fat, that will improve your LDL level, right? A surrogate marker. But the problem is we know that these omega-6 seed oils increase the oxidation of that LDL, even if they lower it. And so with salt, it was simply linked to blood pressure. And about 80% of people with normal blood pressure aren't salt sensitive. And even people with pre-hypertension, 75% are not salt sensitive. And then about 55% of people with high blood pressure are not salt sensitive. And if you actually fix insulin resistance, you can fix salt sensitivity in the majority of people. So we've sort of taken the easy route and doctors just automatically say lower salt because in some people it will lower blood pressure. But again, is that a healthy reduction in blood pressure? Probably not, because there's increases in aldosterone, noradrenaline, right? The activation of the sympathetic nervous system. And you lower blood pressure because you're just volume depleting someone. So again, it's just been based on 50 years of basically the dietary goals coming out and saying lower salt because it was linked with lower blood pressure.
Yeah, it makes total sense, right? And it's kind of speaking about, a little bit of a superficial understanding of how the body manages minerals and why the body's managing minerals, right?
Yeah.
How would you explain to to people looking at thinking about their own salt intake, what salt does in the body? What we've talked about, say reducing your water intake, that's going to reduce your blood pressure. But what does salt do in the body? And we talk about how the kidneys manages salt. What is happening there with mineral balances and fluid balances in the body?
So I think most importantly, salt allows us to digest food because it makes up hydrochloric acid. So the chloride that is part of salt, right? Salt is sodium chloride. That chloride makes up hydrochloric acid. So if you want to be able to digest your food and then absorb your nutrients, it's been proven that low salt diets reduce the acidity of the stomach. So they increase the pH. And so you do not digest your foods as well. And you can become deficient in numerous nutrients like B12, magnesium, zinc. A lot of nutrients are dependent on a good stomach acid. So it really starts right in the gut and you can't just fabricate and make. The body just doesn't synthesize chloride. You have to ingest it through eating salt. The other factor is immunity. Chloride makes up hypochlorous acid, which our white blood cells use to kill infections. Chloride has an important role in not only digesting and allowing us to absorb nutrients, but also it helps you fight off infections, right? That's like your first line defense. If you ingest a virus or a bacteria, is hydrochloric acid. And then in your body, that chloride is also used via hypochlorous acid to kill invading microbes, basically.
Yeah, so there's, you're talking about very fundamental, processes in the body that, if we demonize something like this, and there's an interesting spin actually, isn't it? That we've been told that, salt is bad, but you've also, you authored a paper about how the connection between sugar and the damage that, eating this other white powder in our modern diet, and how that ties into a lot of modern sickness we see. So, what are some of the downsides of potentially eating a low salt, high sugar diet today, and how is that pinning into potentially into type 2 diabetes and some of this metabolic syndrome that we're seeing?
So what's interesting is we have taste receptors for sugar and salt. And what ends up happening is if you are deficient in salt, there has to be some type of mechanism that tells your body, okay, you're deficient in this essential nutrient. You need to go out and seek it. Otherwise, you could, die of salt loss. And so what the body ends up doing is if you don't get enough salt, it actually hypersensitizes the brain to dopamine. And so you actually get a greater dopamine response to sugar if you are deficient in salt. And this has been shown in numerous studies. Even animal studies will show that if you deplete an animal of salt, medications and narcotics are more addictive to those animals because you get a greater release of dopamine. So it makes sense that, again, if we have an essential nutrient and we have taste receptors for it, it control basically when you're not getting enough salt, there is this hyperactivation of your brain to get a reward, and sugar sort of hijacks that, and you get a hyper response to that. And I have gotten a lot of questions, and these are valid questions. Well, where would we have consumed pure salt, like from a Paleolithic perspective? Well, our blood and the blood of animals are extremely salty. There's 3,200 milligrams per liter of sodium in our blood. And we could consume salt directly through either brackish water, ocean, or directly through interstitial fluid or organs or blood. So we always had access directly to salt, or we could just follow animal trails to salt licks, right? So we've always had a direct access to pure crystalline salt. But the difference with sugar is that we've never had access to pure white crystalline sugar. It was always through whole foods. And when you refine sugar, let's say you take it from sugarcane, right? You take the liquid out, you purify it, you make it a white crystal. You've basically done the same thing to what you've done with things like cocaine or opium. When you extract a plant compound and purify it, you can create an addictive substance. And that's exactly what happens when you refine sugar.
Yeah, it makes total sense too. And, when you start to think about, sugar cravings and, responses in the brain, when we lose these balances and also the responses with insulin as well, there's a good question here I'm going to throw up because it fits a little bit into our what we're talking about at the moment. Could you explain why lowering insulin levels creates an increased need for salt? Tanya has asked, because when we have these sugar cravings, obviously you're saying, well, hang on, there's a potential, primary deficiency in salt. So what's happening with insulin levels, and is there this need for salt, or was it a primary deficiency in salt in the first place?
So basically, because salt is an essential mineral, again, the body has a way to preserve salt if you become deficient. And the one way to preserve it is to make your body insulin resistant and increase insulin levels, because that will help you retain more salt. And so low salt diets, there's at least 16 clinical studies that have shown low salt diets induce insulin resistance, increase the AUC of insulin upon an oral glucose tolerance test. And so the reason why if you go on a ketogenic diet and you lower your carbohydrate intake, the reason why your need for salt goes up is because your insulin levels drop and your kidneys start spilling more salt. And so that's the simplest answer.
Yeah, and it's something that I think that people, probably experience a lot today. Especially when you've been on a high sugar diet, you're dealing with these, kind of insulin roller coasters. How would you recommend some, people that experience sugar cravings, for instance, what type of ways, do you recommend that people kind of start to replace, a higher salt intake into, dealing with sugar cravings themselves and amounts and so forth?
Mm-hmm. I think it depends on the person. So if someone is not getting enough salt, there have been so many people that have told me just upping their salt intake reduces their sugar cravings. And then there's a lot of other people that understand the importance of adequate salt and still have a sugar craving, and that's okay. But you need to find out certain foods that will help fix that sugar craving. And so really, for me, what works is high cacao dark chocolate with some almonds or some pecans. For some reason, and a little bit of salt too. So for some reason, getting that cacao, the chocolate, but also some protein from the nuts and a little bit of salt, it's a perfect way to get that fix for you. But you're ingesting healthy minerals, right? Like magnesium and manganese and copper through the nuts and the chocolate.
Yeah, that's something I'm doing at the moment. It's winter here in Australia, and I buy a Mayan cacao, and that's going into my nightly nightly ceremony almost, and it totally, because you don't feel like that sweet kick at all. And what's interesting about whole cacao as well is there's so many other tastes in it, and there's no sweet there, but the taste receptors in your brain is going crazy because there's this. And it's going on to, interestingly, what we're going to talk about, magnesium content as well, which is, the body really craves these things. So I'm finding that personally, I recommend that to patients, to start thinking about, how we, taking away this, this idea that we need to completely reduce our salt. But But the other thing too is, and the one thing that you've written quite extensively on is, reintroducing fat as well, right? And that the body is also, has this heavy need for, for fat-based foods, and reintroducing these kind of things has a significant effect on the physiological balances of insulin, dopamine, and so forth as well. How have you found, these higher fat diets with, or generally the benefits of a higher fat diets, and how would you explain that to someone that is coming off a more carbohydrate based diet?
Yeah, that's a good question. I mean, I have probably tried almost every single diet myself. Like, I feel like once you get to like 30 years old, or if you're someone who can't lift as heavy as you used to, and you actually care about your health, you start like mixing up, and just like, for me, I'm like my own like guinea pig, and I want to see like if a high resistant starch diet makes sense, or if I do better on a higher fat. For me, I think right now what's working well is lifting more and targeting protein, and focusing on healthy fats, but sort of avoiding like the fat bombs, like heavy cream and butter. So when I was first doing a ketogenic diet, that was probably one of my biggest mistakes, is I was putting way too much heavy cream in my coffee, just thinking, right, that's healthy. But if you overdo exogenous fat, you're limiting how much fat you are burning, because you're too busy burning the exogenous fat you're eating. So there's a limit to it, but you can get away with a lot more fat if you lower your carbohydrate intake. So you don't necessarily have to worry per se about a quote unquote high fat diet, as long as your carbohydrate intake is low and the carbohydrates that you're eating are whole food carbohydrates.
Yeah, and that's a big message. Is once you transfer to to whole food carbohydrates, a lot of these problems kind of melt away. And it's really interesting as well. Thinking about paleolithically how how we had access to salt, and
Mm-hmm.
within the the organs of an animal, you're going to consume a high amount of these minerals. So it makes total sense, when we kind of strip these things down, how we're changing their metabolic effect on the body, and then how we play with them as well, and how we're learning to play with. I'm going through the same thing at the moment, where I rigorously kind of test the things that I'm reading, and my habits as well. And so, I mean, I love cream in my coffee, but a high fat diet for me has completely changed my life. And that was one of the big turnovers, was that, this flick from seeing that low fat foods were, driving this hunger craving, and that then that we could actually, live on these high, satiating foods.
Mm-hmm.
So what you've worked with Dr. Jason Fung on low carbohydrate diets. How have you seen this in terms of cardiovascular health, and then moving into a little bit, we're going to talk more about brain health. How are these foods affecting people that are potentially at risk of cardiovascular diseases, and the connections to the brain as well?
Yeah, I mean, so much of what it all boils down to is really 4 things that you want to eliminate, right? It's like refined carbs, refined sugar, omega-6 seed oils, right? Those 3 are the main offenders, and like flours, right? Like refined wheats and things like that. And so health can be regained so quickly just eliminating refined carbs, sugar, omega-6 seed oils, right? Sort of like that's like the deadly trinity. But what happens in regards to cardiovascular health with omega-6 seed oils is they have a half-life of 680 days. And so they can get into the cell, they can push out healthy omega-3s. They oxidize not only in your stomach, but also in the actual cells themselves. And so they can increase oxidized LDL. And a huge driver, in my opinion, of cardiovascular disease is over-consuming refined omega-6 seed oils, and also sugar, right? Because even matched for calories, sugar induces more insulin resistance than starch. And insulin resistance obviously is going to increase blood glucose levels, which is going to damage the endothelium and lead to, cardiovascular disease as well.
Yes, absolutely. And the drive of inflammatory markers with omega-6 intake, yeah, a huge a huge factor in the modern diet. Where do you think people are getting these mainly from in their diets today? Like, what are the foods that that are tipping this omega-6 to omega-3 ratios?
Primarily restaurants and packaged foods. So any food that's packaged, you typically scroll through the ingredients and you're going to start seeing things like corn oil, safflower, soy, canola. I don't know why they put this stuff in there, but they just decide, hey, this is cheap oil, right? Let me just throw it in there. And, it's in most packaged foods, just like refined sugar is. And most restaurants cook with cheap omega-6 seed oils, right? They don't use healthy, organic, extra virgin olive oil or coconut oil or pastured butter because that's expensive. So when you go out, it's funny. One of my followers had just kind of mentioned, I bring my own olive oil to the restaurant, they said to me. And I was like, that's such a good idea. And sometimes you have to be your own health advocate. You might look a little weird walking in with your own, Italian organic extra virgin olive oil. But it beats ingesting, a couple tablespoons of, that oxidized oil.
It's a total, maze out there, and especially in the US as well, spending a lot of, I've lived there, and the packaging and the infiltration of omega-6 oils into the food system there is unbelievable. It's a problem here in Australia as well, but it's very difficult to avoid, and you look kind of weird trying to navigate your way around it, right?
You really do. Yeah.
But the effects on the body are well known. So, if for someone that's reading their blood markers, their cardiovascular blood markers, what would you tell them to be looking out for? And in terms of the risk of cardiovascular disease, because there's a little bit of confusion out there in what are healthy bloods and what what are the actual risk for disease.
So for me personally, I try to focus on triglycerides. If my triglycerides are under 100, I feel pretty good that I'm insulin sensitive. So mine are about, I think around 60 milligrams per deciliter. If you start creeping up above 100, and especially at 150 milligrams per deciliter triglycerides, it's very likely that you are insulin resistant. And typically just dropping the refined carbohydrate intake is going to improve that. HDL is a little, it's harder. Exercise can boost it. So typically, and obviously insulin resistance can drop it. So having HDL like below 45 can potentially indicate either you're not exercising enough or you're creeping towards insulin resistance. Total cholesterol, even if it's elevated, let's say under 300, if triglycerides and HDL look good, it's not as big of a risk factor as doctors would have you think. If you have familial hypercholesterolemia, I don't know if it's necessarily the high LDL that's the problem, or if those people have other problems with their arteries, and having that high LDL is just kind of manifesting itself as a higher risk, because people with a familial hypercholesterolemia also seem to have an increased risk of thrombosis, just their blood clots more. So whether it has to do with the elevation in total cholesterol, we don't know. But if you do have that, obviously you're at a higher risk of cardiovascular disease.
Yeah. There's just a question in here about fats that I'm going to bring up. So Lela asks, can we clarify and talk about fats? What fats are we talking about? I thought cream is inflammatory. Now, we've mentioned before that, saturated fat, the general recommendations that we should be reducing these, but the fats that we're talking about here are heavy on, or more tipped towards the the composition of saturated fats. So what fats do you said you've reduced cream a little bit and exogenous fats, but so what fats do you generally tip towards in your own and what you've noticed in the research?
Yeah, well, don't get me wrong. I do use pastured cream a little bit in my coffee because it tastes amazing. And I just think for me, I was probably putting way too much in there. How I would kind of rank order fats is at the top for weight loss, at least. You have MCTs are probably your best at causing weight loss, and then long chain omega-3s. After that would be your plant omega-3s and plant omega-6s or omega-6 from whole food. And then after that, you have olive oil and coconut oil. After that are your long chain saturated fats like butter, cream. Those are okay fats, and sort of above that are sort of like your good fats. And then after long chain saturated fats, you have your bad fats, which would be trans fats and industrial omega-6 seed oils.
Yeah, it's a great summary, and kind of something that I've kind of just it's confusing talking about like a lot of people there's some, like you said, there's so many diets out there, there's so many different avenues people can kind of take. The whole food message that the way that nature packages these things up, I find the mechanism of fats, that they're carrying nutrients, and their connection to fat soluble vitamins is such a good guide. If they're coming with fat soluble vitamins, these foods are some of the richest sources for the primary the most primary nutrients that your body needs. And so thinking about thinking about macronutrients as a whole can be quite, it's just such a it can be quite a maze that you can get kind of lost in, I guess. James, how do you manage your what are your recommendations generally for carbohydrates, and so for grams of carbohydrates a day if people are counting, and what's a general makeup of of what is considered low ketogenic, and if people are starting to count their carbohydrates?
Mm-hmm. Yeah, so I guess it depends on the person, like everything, right? If you are active, you can obviously tolerate more carbohydrate. With that being said, I try to tell people that even if you are active, or even if you have a lot of muscle, your carbs should always come from whole foods and should never be refined, because they are inflammatory and they can damage the gastrointestinal tract. Low carb, typically is less than 100 grams. And, very low carb is typically less than 60 grams of carbs per day. I have done like a very low carb, less than 60 grams a day, and I did very well with that. And I have also done a high resistant starch diet. I was probably the most cut I've ever been when I was on a fairly high resistant starch, more seafood diet. But after about 6 months to a year, it's not as satiating, right? Like it's harder to maintain that type of diet. But if you do it right, you can actually get very cut. But again, fat is so satiating, and it brings in, vitamin A, E, D, and K. So you got to be careful that you don't lose the healthy fats when you go on like a quote unquote high carb, high resistant starch diet. But even when I was on a high quote unquote carb diet, I probably wasn't even getting more than 120 net carbs, because everything was just so high in fiber, and because it was all coming from whole foods. So you can skin the cat both ways. The problem is when you merge high carb and high fat. That's the problem. So you can do one or the other, but you should never do both.
What did your 100-gram day compared to your 60-gram day look like? Like where did you get your carbohydrates from generally, and what did a 60-gram day look like?
Yeah, it was. So when I was less than 60 grams. I was probably almost like a straight carnivore, to be honest. Just basically eggs and meat. So it was probably more like 20 grams, and some days no carbs. And that works well. Worked well for me. But for some reason, I do good with around 100 grams of carbs. I just feel better. I might not do good with gluconeogenesis. I just might get more hydration, more electrolytes. I might absorb more minerals. I don't know. I just do better with about 100 grams of carbs per day. And where that comes from typically is a sweet potato, purple potato, or an organic potato that is very lightly cooked. So when I eat a potato, even after it's cooked in the oven, it's pretty hard. It's very high in resistant starch. Same thing with asparagus, just a light cook. So it's very high in resistant starch. I don't overcook my vegetables, because when you start overcooking anything, you start basically turning the resistant starch virtually into like just pure glucose. So a lot of it was resistant starch potatoes, lightly cooked beans, lightly cooked vegetables was primarily where my fiber was coming from, and carb intake.
Yeah, makes sense. That's generally recommendations. For whole vegetables, and as your general carb intake, that's kind of I don't count these kind of things. But I know a lot of people do in the exercise. Well, are you still do you still train a lot yourself now? Are you kind of still doing resistance training? You mentioned you had a pec injury, but
yeah, I still do. Right now, I'm probably lifting 3 to 4 times a week, which is good for me. I used to probably only do 1 or 2 days a week, but it's so important for like mental health. And even though I can't lift nearly as heavy, and I have to be very careful when I'm doing any type of chest exercise. I definitely do push-ups and a lot of like weight exercise, and then I will do weights too. So I'll probably curl like 25-pound dumbbells. Or I've been able to work my way up to 30-pound dumbbells in each hand for chest presses, which is, when I injured myself, I went from benching 260 pounds to it hurt just doing 5-pound dumbbells in each arm. But I've worked up to a pretty good point for myself, and it helps so much. With weight loss and everything, because you're just your metabolism goes up just having more muscle. And it's really, for some reason, when you lift weights, I don't know, I don't feel like I eat more than what I've put on. And some people, when they run, if you overrun, that for some reason causes a lot more hunger. And a lot of people, actually, it's almost like counterproductive. But for some reason, when you lift weights, your muscles become more insulin sensitive. And it's very important to have insulin sensitivity, because in order for your body to take up magnesium or potassium, it has to be insulin sensitive. And so as you lose muscle with age, you're not able to utilize your nutrients as well, because you become more insulin resistant. So if you're not working out and building muscle, you can start not utilizing your nutrients as well. And so it is very important to maintain good muscle and good insulin sensitivity.
Yeah, absolutely. Interestingly, I'm doing a lot of work, with patients and jaw balance and TMJ pain, and I'm finding it connects a lot, because we work a lot with body workers, with alignment through the spine and the limbs and so forth. Did you find any, with such a, because I'm thinking, a pec injury, such an asymmetrical injury, and obviously the recovery times, have you found any kind of differences in maybe jaw, sleep, neck, or other postural issues since in your recovery or since then?
Not per se from the injury, but I'll tell you, I was in so much pain for like a couple weeks. I couldn't even like lift my arm. It was so bad. I was bruised here and all the way down throughout my arm. Anyone who's torn their pectoralis tendon, they'll tell you it hurt. It didn't hurt at the time, but like the next day was so bad. But I think people with like allergies or thick mucus, I've been dealing with a little bit of that. I live in an area with a lot where there's like just a ton of trees and pollen and stuff like that. And I'll tell you, like, I tense up my jaw more, my breathing, I'm more congested. And I think, that can affect breathing in a way that I think a lot of people are probably out there suffering with allergies and don't even realize their breathing is probably affected through that. And they might be biting down on their teeth a lot, and not breathing correctly because of allergies too.
Yeah, absolutely. Yeah, it's a huge part of the inflammation input into the airways. James, you obviously, you're super switched on guy that, you're always looking to get the best out of yourself. And you've kind of, a lot of your posts recently have been looking into magnesium, which is a really, a topic of that I've been looking to myself. What have you found, in terms of, well, firstly, if you want to start talking about magnesium, because I love talking about this, but if you can give kind of like an elevator pitch as to what magnesium does in the body, and why it's so important, and then we'll kind of dive in a little bit deeper as to what your processes and personal tips on magnesium are.
Sure. So I think the reason why magnesium is so important nowadays is because if you look at the data from about 50 to 60 years ago, our food is now about 30% depleted. Well, vegetables are about 30% depleted in magnesium compared to about 50 years ago. And animal foods are about 15% lower. So we've lost magnesium just through farming methods, primarily through chemical fertilizers and the refinement of food. So when you refine carbohydrates, you lose 80 to 100% of the magnesium. So our foods are now lower in this mineral, and refining it also has caused a dramatic loss in the food. And so we used to, the estimates from Paleolithic times have been around, we used to consume around 600 milligrams. And in the Neolithic era, when we were consuming more of an agricultural society, but it was an unrefined carb, we wouldn't run it through a steel roller mill, we were getting up to 1,000 milligrams of magnesium. Most people don't realize like a true unrefined grain, traditional grain that's not refined, can be extremely high in magnesium. So we've gone from consuming 600 to 1,000 milligrams of this essential mineral to only consuming like 200. And magnesium is interesting because if you don't get at least 180 milligrams per day, you will slowly start losing it from the body. And a very small percentage, about 1% of magnesium, is in the blood, and the rest is all over through your tissues, your bone. So it makes up the structures of our body. We're not getting as much. We're probably getting maybe a half, if not less, than what we used to be getting. And there's about 60 factors that cause magnesium deficiency. And we published a review paper on those. And that's the biggest reason why magnesium, we're so deficient in it, is because all these factors that cause magnesium deficiency are so prevalent. Primarily insulin resistance and hyperinsulinemia hyperinsulinemia causes us to lose magnesium in the urine, and insulin resistance prevents the magnesium from getting into the cell. And so you have a population, 75% of us are insulin resistant. So you can't even utilize the magnesium, the little magnesium that you're getting, and you're also spilling it in the urine. So I'm just trying to paint a picture of how we used to consume this mineral in high amounts and how we're consuming it at a lower rate now, and how we're losing it and not even able to utilize this mineral. Now, when it comes to like what magnesium does, it is an essential cofactor in 600 enzymatic reactions in the body, which is extremely high. There's very few minerals that actually are required for hundreds of enzymatic reactions like magnesium is. The other thing is that it's required for DNA protein synthesis, and also ATP synthesis. And not a single function in the body will work without those three. So from a perspective of a cell functioning, it cannot function without magnesium because you can't make protein, ATP, or DNA without it. And you can't even activate ATP until magnesium binds to it. So magnesium will bind to ATP, and that's how we activate it. That'll help cleave off the terminal phosphate and sort of liberate energy. From a perspective of cardiovascular health, magnesium controls what's called the sodium-potassium ATPase. And if your magnesium levels start dropping, you start accumulating calcium and sodium in the cell. So you can start calcifying the arteries, and you will start losing potassium because it controls the sodium-potassium ATPase. And so when you see a low potassium level in the blood, it is almost always due to magnesium deficiency, because your body cannot hold on to potassium when you're magnesium deficient. And I can, I don't want to go, I'll pause there, but that's just some of the main functions of magnesium.
No, absolutely. And that's a great summary, because I don't think, people, as a whole, as a society, we don't appreciate how important magnesium is. A great kind of summary. And you kind of, you're really kind of leading into, how, why people really should need to be thinking about this. It is absolutely fundamental for 600 enzymatic reactions in the body. It's a cofactor of vitamin D. And, I talk about vitamin D so much, but without the sufficient magnesium in the body, the VDR doesn't work as it should. And you've really summarized that well. So you mentioned for cardiovascular health. Can you talk a little bit about the specific symptoms that people can be experiencing in different organ systems from magnesium deficiency? And there's different types of magnesium, isn't there? So how these relate, and how what people should be thinking about symptom wise and types of magnesium?
I would say the most common symptom of magnesium deficiency is muscle spasms, muscle cramps, um, and twitches, specifically like eye twitches, and arrhythmias. So basically premature ventricular contractions, atrial fibrillation, atrial flutter can all be caused by magnesium deficiency. Magnesium is also required for the synthesis of our three feel-good neurotransmitters in the brain: serotonin, dopamine, and norepinephrine. And then also, in order to synthesize melatonin, you also need magnesium in the brain as well. And so symptoms could be altered mood, right? Kidney stones, any type of arterial calcification can be a symptom of magnesium deficiency. The list can kind of go on and on, but those are sort of like the main symptoms.
And so there are different types of magnesium out there. What are some of the different mechanisms in the body, and also too, because different types of magnesium are also kind of leading into different availabilities in different parts of the body. What's out there in the literature in terms of that?
So the most common magnesium supplements used are magnesium oxide and citrate, but they have side effects. So magnesium oxide only has a bioavailability of about 4%, and magnesium citrate is a laxative. And so a lot of people are sort of going to the bathroom or having a lot of diarrhea with magnesium, and it's probably because they're not using the correct supplement. Magnesium bound to an amino acid like glycinate and also magnesium malate have better bioavailability. But the only magnesium that has been shown to increase brain magnesium levels is magnesium L-threonate or magtine. And the reason is because the threonate actually brings magnesium into the blood-brain barrier through glucose transporters, and also into neurons through glucose transporters. So it binds to the magnesium and can actually bring it into the brain. And from the literature I've looked at, there's not a single other supplement that can do that, other magnesium supplement.
Yeah, the papers are quite compelling, aren't they? And I've used threonate, L-threonate myself for the last year. I've noticed the difference, and I do. We have it in our clinic now too, and because one of the things I'm seeing is that people with poor sleep and unrestful sleep, where the autonomic nervous system doesn't calm down, there's underlying breathing issues there. But a lot of these people need bioavailable magnesium, and for a long time I was recommending magnesium supplements, and the sleep wasn't quite getting there. I was still seeing tension in the jaw. You mentioned muscle spasms. People do get these kind of things in the TMJ, and I was seeing that some of the supplements that people were taking, or if they were just taking magnesium supplement, alongside what their doctor was recommending, we weren't seeing the improvement in sleep. But once L-threonate came into the picture, I was starting to see people were saying, "Hey, I'm sleeping a lot better, and my jaw's feeling a lot," and I'm noticing the difference in the mouth. And so this bioavailability to the brain, that was really interesting to me, because that's what I'm trying to do when you're trying to calm down someone's autonomic nervous system. And the literature really explains this well. And they compare the different types of magnesium, don't they, and how that it infiltrates into the blood-brain barrier. What does magnesium do in the brain? Can you help people kind of understand this a little bit?
Yeah, so there's certain enzymes in the brain, just like throughout the body, that magnesium is a cofactor for. So dopa decarboxylase, which is needed to form dopamine, is dependent on magnesium. From the tryptophan all the way through to serotonin, every single enzyme requires magnesium. For converting serotonin to melatonin, also requires magnesium. So because it's a cofactor, it helps form neurotransmitters and melatonin. The other thing is it sort of acts like it sits in there's the NMDA receptors, and you can hyper excite those if you don't have magnesium sitting inside the channel. It's sort of like a blocker. If you don't have enough magnesium and it's not there, calcium can come through a lot and sort of do that glutamate excitivity. So it's sort of you have this in a lot of disease states. There's sort of this hyper excitability of the brain, And a lot of times it might just be magnesium deficiency in the brain.
Yeah, no, makes a lot of sense, and the connection to neurotransmitters too, like so important, because this imbalance between conversion of serotonin to melatonin is something I'm just seeing so commonly now, and it's a very difficult problem to fix. And I really think it's related to this problem of not being able to get this magnesium to the brain. So it's so great that you're bringing this to light. I'm just going to bring up some questions here regarding magnesium. Because for daily coffee consumers, can coffee and tea deplete magnesium and other minerals from your body?
Yeah, it can. If it's causing you to have diarrhea, we sort of have this enterohepatic recycling. And if you drink coffee and it causes you to lose the bile that is being recycled, so bile contains magnesium. And if you have diarrhea, it can flush out the magnesium from your bile, and it can also flush it out from the food you've just consumed. So it just depends. If you're not consuming a high dose, it's probably not depleting you of magnesium. But as you start increasing your intake, or if you're sensitive to coffee and you're having a lot of diarrhea, it could absolutely flush out magnesium from the body.
And one thing that magnesium sulfate via salt baths. So if you put magnesium salts and have a hot bath with it, is this a good way to get magnesium through the body?
Yeah, I get that question a lot, and it actually is a very common and somewhat complicated question. I think you can have local topical effects, but unless the skin barrier is broken pretty significantly, you're not going to absorb magnesium into the blood, and it's not going to boost your magnesium status. And the reason why I can say that with confidence is if that were to happen, if you were to absorb minerals through the skin, you would die pretty quickly going into an ocean, because you would instantly just be filled up with salt and magnesium, and you would basically probably explode. You know what I mean? Like if you're just sucking up all these minerals through the skin.
So actually, I hadn't thought about that before. That makes total sense. Your body really needs a protective factor there, right? Yeah.
Exactly. Yep. So you're not going to really boost your magnesium status by bathing in Epsom salt baths. But for some reason, a lot of people experience a good amount of like muscle tension improvements, because there does seem to be some local topical effects.
Yeah, sure. No, that makes sense. And for magnesium testing, what are the magnesium tests out there, and can people get their levels tested, and what should they be looking for?
So for most people, they're probably going to only have access to a serum magnesium level. And some people might get a 24-hour urinary magnesium. I think actually blood magnesium can be used very smartly if you sort of notch up the lower end of normal as being not normal. And so when we published our review paper, really less than 2 milligrams per deciliter is suspective of magnesium deficiency, particularly if your urinary magnesium is 80 milligrams or less. And so about a third of your magnesium intake should come out in the urine. Most people consume 250, maybe 300 milligrams. So you should see about 100 milligrams. If you're seeing less than 80 and you're sort of on the low normal range of serum level, that's highly suspicious of magnesium deficiency. I mean, the gold standard is IV magnesium load. And so, when you give it IV, basically 80% or more, really more than 80% should come out in the urine over 24 hours. If you are retaining 20% or more of that load, that is highly suspicious of magnesium deficiency. And definitively, if you only spill, if you're retaining 50% or more of the dose, then that is considered definitive magnesium deficiency. And you can do an oral load as well and see how much comes out in the urine as well. and there's some other tests too. Mononuclear blood cell is probably the best blood test for magnesium, but it's more of like a research tool. If you're able to order that, that's amazing, because that has been shown to match IV magnesium load, but it's less invasive. Getting ionic magnesium is better too than serum. So the active form of magnesium is the ionic form, the ionized form. And so you can get ionized magnesium levels, particularly ionized compared to total, and that can show you if you're deficient in the active form of magnesium. And so basically your bound magnesium is always trying to maintain optimal levels of ionized magnesium, the active functioning magnesium. And some people can have normal serum, but their ionized magnesium is low. And some people can have low serum and their ionized is actually good. So it's kind of like it just like with everything, it sort of takes 20, 30 years for these things to ever become mainstream. And I don't think we're going to see these tests for a while, like mainstream.
Yeah, totally. I've noticed that in the functional medicine community, and just trying to get interface with doctors in terms of magnesium testing. It's the availability is very difficult, and there seems to be confusion as to exactly the intricacies of what we're actually testing here as well. So that's a great explanation. There's a good question here on what are some of the natural sources of magnesium that you jump to before we go into the high powered supplement that you recommend.
Yeah. So magnesium is so key because, most carnivores are consuming meat and eggs, right? And even if you're consuming liver, you're not getting really good amounts of magnesium. It's just pretty deficient in those types of foods. And so there's the carnivore way to do it, and you can get it through natural mineral waters. So Gerolsteiner is got about 100 milligrams of magnesium per liter. So if you drink 2 to 3 liters a day, you can get 200 to 300 milligrams of magnesium in an ionized form, a highly bioavailable form. So that's one way to do it. Sort of the downside though is it's fairly high in bicarbonate. So you got to be careful, right, of lowering your stomach acid too much and just solely relying on mineral waters, especially if they're too alkaline, and how you time that with meals is important. So typically, like when I drink my water, I try to drink a good amount early in the day, absorb it and get it into my system, and then get my stomach acid back to baseline for a meal, and try to limit my water intake close to a meal, and especially a couple hours after a meal to let my stomach acid do its thing. But good sources of magnesium: nuts, dark chocolate, spinach is good because magnesium makes up the center piece of chlorophyll. It's like in the center of that molecule. So when you think of magnesium, greens, right? Greens are a good source. Trying to think what else is. Shellfish has some. Certain shellfish has some magnesium. Beans, unrefined traditional whole grains, like the only whole grain really that I'll eat is Ezekiel bread. Ezekiel bread is just sprouted grains. But if you actually look at it, like one slice, it's got good amounts of manganese, magnesium, selenium. So certain unrefined traditional grains have good amounts of magnesium too.
Yeah, Jay, it's a difficult mineral to get from the diet now, and as we talked about before, depleted soils has been a huge issue, and I think as well as we're so far from where paleolithically we were used to consume this. It's one of the minerals I do recommend. People think about supplementation for those reasons, and the research that you've talked about, and for the highest bioavailability in the brain, is one of the supplements I've been recommending for patients. There's been some questions again. Can you talk specifically about L-threonate, the dosage you take and recommend, and a specific brand that you recommend people take?
Yeah, so the dose that I take, because my diet is really good in magnesium, I only need 1 capsule of Magtine which gives you about 72 milligrams of elemental, but it's a very bioavailable form. So there's a study showing that the bioavailability of magnesium L-threonate is around 60%, whereas magnesium oxide is only 4%. And so, yes, lower, cheaper forms like magnesium oxide are a lot lower in cost, but you sort of get what you pay for. Typically, what I did was I just started taking one capsule, which is 1,000 milligrams of total weight, which is 72 milligrams of elemental magnesium though per 1,000 milligrams, because the threonate is a large molecule, but it helps get magnesium to where it needs to go. I only needed one a day. Some people will do twice a day, but typically you want to start low and go slow. Where you only take one capsule, and that helped me, and I didn't need to go up higher. Some people, they'll maybe do that for a week or two and throw on a second one.
Yeah, sure. And so that's 1,000 milligrams per dosage. That's correct. And so what are the some of the standard dosages for L-threonate out there and compared to Magtein?
So typically, if you look out there, magnesium L-threonate, most require 3 capsules. I get mine from Magtein.com, and that's only 2 capsules, and it also has vitamin C and vitamin D. So the vitamin D is important, right? Because magnesium helps activate vitamin D to the active hormone. So having D and C there is nice. And the typical dose, well, the dose that was studied in a clinical trial in patients with cognitive impairment was 1,000 milligrams of Magtein twice a day, and that showed significant improvements in cognition. So that's like the sort of clinically studied dose.
Yeah, and it's the benefits and the clinical symptoms of Alzheimer's disease. It's fascinating where this is directing to. The nutritional input into how we prevent cognitive decline. It's a huge area that I've been researching, and so the fact that we started talking about this a few months ago, I was just so happy that you've been out there and recommending. And I do find that magnesium supplements it's just a whole maze out there, and so you really want to kind of jump in to find the really bioavailable form. I've tried your Magteins; they're great too. Yeah, so I take 2. I generally find for me, I take I need a higher dose, but I've found personally that they've really helped. The way I feel, the way I sleep. One thing I've noticed actually is dreaming. Is that you actually have more vivid dreaming.
You do,
which is interesting, right? Have you experienced that?
Yeah, I have. Mm-hmm.
Yeah, it's interesting. Yeah, James, there's been so much info put down in such a short amount of time. We've got so much to talk about, but I know you're a busy guy, so we'll leave it there. Where can people find you? And if you want to just repeat that supplement that you take and what you recommend, and I'll be putting that in the show notes at the end too.
Sure. Yeah, so the magnesium I take is Magtein at Magtein.com. And people can follow me at Dr. James DiNic on Instagram and Twitter, or they can go to my website, drjamesdinic.com.
Thanks again, James, and keep doing all the work that you're doing. We'll be looking out for all the exciting things that you'll be putting out there. I'm sure everyone enjoyed this, and I'll definitely be jumping on to get my magnesium L-threonate.
Nice.
Thanks again,
Steve.